Carrie Evans. I'm a board certified nurse practitioner, and I own Pure Beauty and Wellness. We're located in St. Clair Shores. We are a luxury medical spa. So my background comes from a little bit different than our other speakers today, but I hope to end on some fun things, because nothing is like, what is it saying? Off the table, on the table? Like, ask me anything. If I don't have the answer, I'll get the answer for you. I can shoot you a text or an email if you have any questions. So I brought some presents for everybody before you leave. Even if you have to leave before I finish talking, please come over to the table. Everybody gets, there's a card on here with $50 off, and then just a free lip balm. The lip balms are, I know, everyone likes a lip balm. So lip balms are all natural. All the ingredients are listed on the lip balm. If you are lucky enough to be able to read it, because it's quite small, and they're all different flavors. The font's quite small on there, but no SPF in the lip balms, just so you know, because I don't want anyone to get sunburned lips. So what are the things that we do at Pure Beauty and Wellness? We specialize in all things skin health. So you could think of facials, laser treatments, like laser hair removal, tattoo removal, scar revision, okay? We also specialize in skincare, chemical peels, and I specialize in cosmetic injections. What does that mean? I can take what you were born with, and then we can, in a non-surgical way, make it more ideal to what you want. I know everyone's so excited, especially this side of the room. They already want to ask questions. I mean, I can talk nonstop, but I would rather talk about what you want to hear about. So I have patients that were born one sex, and then they're in transition, but may not have had gender reassignment or any of that yet, but they want to start with cosmetic injections. So what I can do is make a masculine face more feminine if that's what the patient desires, and vice versa. I can also take a more feminine face and make it more masculine in a non-surgical environment. I'm not a surgeon, I'm a nurse practitioner. We stay everything on the up and up, and safety is my number one goal, right? I wish it was just outcomes, because I just love making people feel good about themselves. And when we look good, we feel good, right?
Yes.
Okay. So then what I do is when patients come in for consults, we sit down and we have a half an hour, and I lean into them, right? We take a boring health history because I have to, right? For clinical reasons and for safety. But then we get into what are your goals? And we talk about how to achieve those goals in a safe manner. So does anyone have any questions so far? Because there's some antsy pants over here. Okay, you have a question right now? Okay. Does anyone have a question to start?
I just like, because you mentioned like laser and.
Yes.
Just wanted to know more about like.
So laser hair removal, we do laser tattoo removal, we do skin rejuvenation, and the lasers that we have cover all skin colors. So we're all on something called a Fitzpatrick scale. The Fitzpatrick scale, it goes from 1 to 6. For example, I'm a 2. Jackie, you're a 2. You're a 2. Derek's probably a 3. You're between a 2 and a 3. This gentleman back here, you're probably a 5 or a 6. So we're somewhere all along that scale. And when we do laser treatment, it's according to your Fitzpatrick scale. Because the darker that our skin is naturally, those laser settings have to be set specific for your safety, right? So then the lasers are set specific for mine, right? So, because I'm only a 2. So, because we have to be careful, because we could burn somebody. So they want to have like a laser hair removal. We don't want you to be burned inadvertently.
I actually got burned. I would go to Ideal Image, I think it's called Milan.
Okay.
And they switched nurses on me, and she just kind of like just went all over, and all my
That's why
hair
I'm
was black.
scared. I'm like, I need somebody to.
I have this mark on my face that's like there permanently now.
I'd be happy to look at that later today if you want. So it's very important. So it's very important that the clinicians have followed protocols, right? And follow standard procedures that are recommended, for example, from the lasers manufacturer. So we always stay within those. It's very important. So safety is my number one result. I want everyone to be safe, and if they're safe and they feel comfortable in a uncomfortable situation, then they leave and they feel more like themselves. So, I did not realize people had an aversion to needles, probably because I'm biased and I'm with needles all the time. And I actually brought supplies to give out some vitamin injections. Now, no one has to do this. I didn't expect this many people, so I apologize. I have enough to do 10 only today. And I could talk about that too as well. But any other questions about laser or like cosmetic injections?
Okay, now when you say laser hair removal.
Yes.
Can that be anywhere on the body?
Yes, so we do offer a Brazilian for everybody. It doesn't matter. We just follow protocols. And again, so that's a good question. So for the head, no, because of the discomfort. It's not clinically indicated at this time, because I do have some patients that wanted like hairline removed, because it's meant to be there, and it's so thick, the hair follicle, it's very difficult and challenging. But my thing as a safety, it would be so painful, and it's not clinically indicated. Oh, now in the future, maybe that would change, okay?
Do you do electrolysis for bottom surgery for transformation?
We only offer laser hair removal. I know there's some electrolysis areas, but we don't offer electrolysis. It's laser hair removal. So the hair has to be pigmented for it to work with the laser, meaning it has to be brown or black. If it's blonde or red, or doesn't have any pigment, the laser is not going to pick it up, because the laser is attracted to the pigment of the hair follicle. So every time we have hair removal, and it is a process, okay? So if we're doing laser hair removal around here, it's every 4 to 6 weeks. If we're doing laser hair removal around here, it's like 6 to 8 weeks, and it's consistent, it's routine, it's a marathon, it's not a sprint. So it is some work. Okay? Does anyone else have any questions? Yeah.
Do you do like skin lightening procedures or anything?
I don't have anything for that. Mm-mm. Yes.
Okay, now you talked about, cosmetic thing.
Yes, that's my favorite.
Are we talking, so do you use, fat, or do you do like, filler?
Yeah, so cosmetic injections would be things like PRP, platelet-rich plasma, comes from our own body, right? So if someone doesn't want like an outsourced Botox, lip fillers, things like that, yes. I don't do fat transfers. Technically, that would be like a surgical intervention by a physician. Again, I'm a nurse practitioner, not a surgeon. Does that answer your question? Okay, thank you.
I have a scar on my boobs.
Yes, makes
Like-
two of us.
How is the possibilities to get rid of them? How
So-
many sections?
Yes, so what I would do in an assessment or in a consult is assess that area and go over potential treatment options with you. Laser's definitely part of it. I have a whole scar revision protocol. So the scar revision treatment that we would do would be based on individual
I never
needs.
thought about it. But
Yeah.
last week actually I was like, I need to do something about it,
Okay.
because I do everything for every part of my body, but I haven't treated my scars.
Okay.
And I'm like, I'm ready for it.
Yeah, the scars are really a concern. There's multiple modalities that we can do. Some skin types are more prone to keloids or bumpy, hardening, and we don't want to make the scar worse than it already is. So there's injectable options, which I will numb everybody as much as I can. If I can numb you, you're going to be numbed, because I don't like to give torture to anybody. And lip filler can be very painful, but I do a dental block, so I just block you. So the dental block kind of stinks, right? It's a little numbing, it burns a little bit, but I warn you, I'm like 1, 2, 3, we're holding the vibrator, we got the ice, I numb you, and then you don't feel any of this for that, half an hour that we're like doing lip filler. I just used lips as an example because lips have such high nerve endings and it's so stimulating. That's why kissing is so much fun. So we gotta block that out so that I can do what I need to do. And now I know that people are more adverse to injections, I mean, my practice doesn't show that, they love injections. Any other questions?
Is this all like out-of-pocket costs?
It is, it's a cash-based, yes, and so what we do, at Pure Beauty and Wellness to make things more affordable, is things are in packages. So during your consult, I go through the package with you, I have packages that start at $750, and they can go all the way up to $4,500. Now, you know, and when I created these packages, I thought of, one of my patients, and I thought of them for each level. So the $750, I was thinking of a certain, specific type of patient, and my $4,500 is like the mother or the father of the bride, and they want to get rid of all their old sun damage and maybe some hair or old tattoos or whatever they have to do, because that package includes a lot of things and multiple visits.
Do you do financing?
We do. We have 3 different, right? It's still 3?
Yes, yes.
Okay.
So I'd like to add, yes, we do offer financing through Care Credit, Cherry, and a new financing option that we brought on, Patient Fi. There are not any hard credit checks. They're all soft. They do 6 months interest free. So it's sort of like when I buy furniture. I'm sorry, I'm always financing it because why pay the interest, right?
Right.
And we also have had patients come in if they have an FSA or an HSA account through their work or through their employer. You are able to use that benefit at our med spa too. Yeah. So, so I just like to put that out there because
You had
it's
another question.
it's a
What was
great way to use your
Okay,
FSA,
so,
right?
A lot of our community members have like silicone injections, right?
Mhm.
Whether this is a lip,
Mhm.
cheek area, or anything, like we capable and able to work around.
Yes.
silicone?
I actually created a consent form just for that, because silicone is not meant to be permanently placed in the face. I mean, 20 years ago, we did things that we don't do now,
Yeah.
right? We know that there's safer options out there. So if my patients know that they have silicone, I have them sign the waiver for that, the consent form, and I sit down and discuss, risk factors and things like that, because it does increase risk if you're injecting over something like silicone. Any other questions?
Can you just reiterate the safety of coming to a professional?
Oh, yes, thank you so much. I know, especially now, I've been in business for 10 years next month. Like in a couple weeks, I'll celebrate 10 years in business, owning, a medical practice and like a cash-based one, and this world that we live in can be interesting to maneuver hoops and things like that. And I know that there's a lot of Botox parties and basement events that those people may or may not be professional, and they may or may not be injecting you with cleared product. So at my practice, we only use FDA cleared, treatment. Do I treat off label? Of course I do, but that's what the informed consent's for, right? So a patient says, oh, I want this, and it's not something that was like cleared by the FDA. That doesn't mean I can't provide it to the patient in a safe way to get the desired results. So does that answer the question, or am I going in circles now? Because I can talk about this stuff all day long.
That's all I need.
Yeah, it's really important for your safety that minimally in the state of Michigan, you want it to be an RN, nurse practitioner, PA, or a physician, dentist, but they've taken the classes and they have the certification to be doing these types of treatments. You want to make sure that the clinician is very well versed in anatomy and physiology. You don't want someone injecting that doesn't know what they're doing, and then you end up blind or dead. So, there is one case, it was out of Korea 4 or 5 years ago, and someone was getting nose filler and they ended up passing. So if I tell you no for something, it's not because I want to tell you no, but it's for your own safety. And I'll explain that, in private, in the consultation. If someone asks for something that's not safe, I explain why it's not safe. And that doesn't mean that they may not leave my practice and go somewhere else. I live by 4 core values, and I cannot sleep at night if I'm not ethical. So we provide, a safe environment, and again, I'm a nurse practitioner with 10 years experience. I've spent way too much money on taking the latest and greatest. We've seen so many trends go like from silicone to, now we don't do that. Even just in the last 10 years, there's just so many things. If someone isn't, or if they're not doing this full-time, right? This isn't their full-time job. How are you going to get the best care to going to somebody that does something part-time? I'm not having a part-time plumber fix my leaky toilet. I don't, right? Or I'm not going to cardiologist to have my face done. I want to go to somebody that specializes in that field of medicine. So that's like my little 2 cents on, seeing a professional. Our licenses are all up on the Laura website, the state of Michigan. So you can see my RN, my nurse practitioner license, their license. So and if we've done some faulty things, it's on our license, on the internet for everybody to see. There's nothing hidden. So you'll know if somebody's shady or not. You can look them up. These are really good questions. Is there anything else that anyone, no, there's no wrong question.
In your clinic, it's just you or is another doctors?
So Jackie's basically my manager. So she does
Okay.
everything that's non-clinical. I'm the nurse practitioner. I do have a medical director, Dr. Adair, and he's fantastic. And then I have another RN injector, and I have 2 laser techs and an esthetician, right? I didn't miss anybody. So soon, one of the laser tech will also be a licensed esthetician. So then we can have 2 rooms going for facials and different things as well. Our facility just moved a couple weeks ago to Jefferson, just north of 10 miles. We're located in St. Clair Shores, just minutes off 94 and 10-mile exit, and we're pretty easy to find. We're standalone building now, which I'm so happy for. So we don't share a building, we don't share anything with anybody. You park in the street or parking lot, you walk in, and then you come see me.
I'm not sure what the name of the procedure is with like the blood and like transferring the blood over.
PRP, yes, we do. So it stands for platelet-rich plasma. You can also refer to it as PRF, which is platelet-rich fibrin. So it's just a little different way I spin things, like in the centrifuge that separates. The younger we are, the better our PRP is, because, right? So, but yeah, we use PRP for a lot of things. I did a great case this week where I put PRP mixed with just regular old Restylane filler, which is a clear gel. It's hyaluronic acid. We blend it, and then I inject it to add, to correct the volume loss through this area. And it's like undetectable. The results are great. If you're not following me on socials, please do. You can get to us from the QR code that's on the cards, because I really want everyone to take one of these on their way out. It's my little thank you for coming today. But those pictures, will be posted soon.
How intense the peelings that you provide?
Pardon me?
The peelings?
The fillings.
No, the peelings.
Peels.
Peels.
Yes.
treatment.
So we offer 2 different types of chemical peels. We have a light chemical peel, which is my preference, because then I have no downtime. So that peel, you come in, it's a 15-minute appointment. The peel sits on the skin for 3 minutes and then comes off, and it comes with a facial massage. And that's safe to do as often as once a month. And then we also have a medium depth chemical peel, and the medium depth chemical peel also is safe for all skin colors, because that makes a difference. Because some darker skin, we have to be careful where you're using the right things, because they're more at risk for keloids and some other things. But the medium depth, you'll peel like a snake. So you need about a week of healing time. That doesn't mean you can't go out in public. I just have some tips and tricks for when our patients have that, and how to stay covered up from the sun and avoid sun damage and things like that. So that's it. So I don't offer like pheno peel. That's, no, just light or medium, because those are what are safest. And we combine them often with laser to get the best results for scars, for pigment, for texture, you name it. I mean, we all have skin in here, right? We all want to take care of it. So that's what you come to me for. Any other last questions? No?
Okay.
Thank you, Jerry.